Hello, my name is Brandon Ramacco, and today we're going to use a Suresult D3 Ultra to take a look at a baby, a 6-month-old baby, and see how strange a baby looks with ultrasound. And we're going to compare that against myself. Now, what's great is with this ultrasound, we have access to split screen. So we'll directly compare side by side with a structure from my leg to a structure on the baby. Now, ultrasound is great for evaluating babies. You can evaluate tears, muscle tears, tendon tears, ligament tears. You can evaluate for fractures, dislocations, hip dysplasia. I have another video for that. But babies look very, very strange. Muscles look pretty normal, but if you're talking about ligaments and tendons, they can look very hypoechoic. And the bones, don't get me started on the bones, because you have all those different growth centers and there's so much cartilage, they can look very, very strange. So what you might have to do is you may have to use that split screen feature, take the asymptomatic side and then do the symptomatic side and see if you can see a difference. And now let's look at some muscle, sort of some calf muscle. This is normal calf muscle. Right. And muscle in long axis, that's what muscle looks like in long axis. And what about baby's muscle? See, they look pretty much the same. So for muscle tears and such, and in fact, her neck, right after being born, had muscle tears all throughout one side. I guess it's a pretty traumatic experience being born, particularly, I suspect, the doctors sort of guiding the head. They say they're not supposed to pull or twist in the head, but how do they move the baby? They move the baby by twisting the head. So the side of her neck all torn up. And there's studies that, it's over 90%, I think, of babies who have muscle tears in their neck. How did they figure that out? Ultrasound. So maybe now we'll do the Achilles. So there's my Achilles tendon. Okay, and now baby. Right, so we can see we have our tendon. It's there. But look at the attachment. Strange, eh? Anyways, I just wanted to give you an example of, using the Suresult to look at a baby 6 months old, and this is normal. I'll add that if you're interested in one of Suresult's units, that they've asked me to mention that the shipping and duty and all that stuff, they try really hard to sort that all out for you. And they also try to make sure that the units meet international standards. And of course, if you have any questions, you can just message them on WhatsApp. And I guess that's it for today. Cheers.